This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. I'm Natalie Baggio, and today's episode is about care in Watervliet and Hartford area. And today I'm joined by Connie Harmon, our Chief Nursing Officer in Watervliet. Welcome, Connie.
Thank you for having me.
Thank you for being here today. I'm really looking forward for you to be able to share with the community all the great services that we offer in Watervliet to keep care close to home. But first, would you share about your background with our listeners?
Yes, I have been with Corewell now for 43 years, and it's part of where I live, and I've never left since high school, actually. So I worked in multiple departments. I've worked in the hospitals. I've worked in Niles, St. Joe, and Watervliet, and I've been at Watervliet now for about 15 years. 13 of those I've been in the chief nursing officer position. So I cover the Watervliet hospitals and the clinics, and just been a nurse and over direct care nursing.
Connie, I'm really excited about all the services that you're sharing, and one you mentioned is the cardiology clinic. So do you have providers that are specifically just in Watervliet?
No, it's a system, and so our providers go to all. I think they're even in Niles.
Yeah.
And so they are at all three hospitals and sites, and it's just, you can have, and it's, I think 5 total. So you can have a different provider and follow them and get care where you need it.
That's really great. And you mentioned about the testing. That is really wonderful that we are able to offer that in the Watervliet clinic. I know that sometimes you may not be able to have your surgery performed at Watervliet Hospital, but you can have that workup done right in your hometown.
Yeah.
That's wonderful. It's a really new service, and we're really proud of that service to be in the community. You also mentioned about outpatient surgery. So the surgeries that you're doing, ortho, foot and ankle primarily, patients don't stay overnight. They go home the same day.
Yes.
And tell us about the patient experience. How do the patients like that?
So our patient experience scores, I'm super proud of at Watervliet. It's a family feel, and so the patients come. It's private rooms, and they enjoy their stay, and they want to come back. In all of our areas, because sometimes we can get them in a little bit quicker than the bigger hospitals, and it's just a friendly atmosphere, and our patients let us know when they do the surveys, and super proud of that.
Yeah, one of your recent board meetings, one of your board members shared with us their experience of coming to have their labs drawn.
Yes, yeah. In and out within like 15 minutes
from
the time of registration to the time they were out the door.
Which is amazing. And you just walk right in the front door.
It's not always,
but usually. That's the goal.
Yeah.
I think another thing that I've noticed coming into Watervliet Hospital is just the calmness of the building. And I know you've spent a lot of time and investment in upgrading those facilities. And it really, you can feel that when you enter into the building. One other service I want to go back to that you mentioned is that you have a walk-in clinic. So how many days a week is the walk-in clinic open, and what are like some standard reasons someone would choose the walk-in clinic over going to the emergency room?
So the walk-in clinic is when you can't get into your primary care doctor and you just have an illness. So a lot of the respiratory illnesses, it's not for emergencies.
Okay.
It does take some lacerations. Some people have... sometimes we're getting known for hearing. I didn't know that they flushed people's ears out and stuff like that. So they do a lot of minor suturing and just minor things that have been going on. And then it's a level of care, though, that is appropriate if your doctor's office is not available.
Oh, that's great. Yeah, so it's just those
and
minor.
It's 7 days a week.
7 days a week.
Yeah,
What are the hours?
8 to 8.
8 to 8. That's great. So if there was one thing that you would say excites you about the future of Watervliet Hospital, what is it?
I think what excites me is when we first got in the community, when Corewell took over, when I went to the Chamber of Commerce and they were like talking and they wanted some reassurance. We're here to stay. You know, so we are invested. We have up-to-date equipment, and it's so exciting to stay current with what's needed to take care of our patients, to provide quality care and keep everybody safe. And we're really looking towards the future. What do we need? And we're looking at growth opportunities throughout the system, but definitely even in the Watervliet, Hartford, and Coloma area. What services are needed to keep patients out of the hospital? And how do we get them access to our primary care clinics? And even we do have specialty clinics too in our area. And it's just, how do we offer those services, keep them current, and just be available for our community?
So if people are interested in accessing the lab, radiology, cardiology, what is the best way you would advise them to get in contact?
There's multiple ways to get in contact. I mean, you can call the numbers and you can schedule appointments. We do still do walk-in visits, and not so much in cardiology. Nuclear medicine tests and CAT scans have to be scheduled, but it's just reach out and call. And, you know, they offer all sites when you make that phone call, and hopefully sometimes we'll be quicker and can get you in sooner.
Well, thank you for joining me today. I'm really excited about the direction of where Watervliet is going, and keeping care local is definitely part of the mission. And you and your team are doing a great job of ensuring that becomes the reality and it's sustainable.
Well, I appreciate that, and I love working at Corewell. That's why I'm there so long.
Thank you. Thank you to our audience for joining us today on this episode of Core Conversations.